Patrick, Squidward. And I'm Dr. Danny, a medical doctor training in psychiatry, and we're about to analyze some more SpongeBob characters. So let's start with Patrick. He's not the brightest. I think he has intellectual disability. To diagnose intellectual disability, the person has to meet 3 criteria. Criteria number 1, deficits in mental abilities. This is usually measured with intelligence tests. They measure things like abstract reasoning,
I'm shrinking!
problem solving,
You should take Bikini Bottom and push it somewhere else!
and judgment. Now, criteria 2 is deficits in everyday adaptive functioning. It's measured in 3 possible domains. Domain number 1, the academic domain. Can you do the necessary basic everyday math? Can you read and write? Number 2, the social domain. Do you have social awareness of others' thoughts and feelings?
Hi, SpongeBob! The SpongeBob! Who's SpongeBob?
And the third is the practical domain. Can you take care of yourself? Or can you hold a job?
Wow! They put a tiny me in this belly scratcher!
In real life, symptoms must have started during child or teenage development. If symptoms occur after the developmental period, it's considered a neurocognitive disorder, which includes dementias and neurocognitive disorders from hitting your head very hard, also known as traumatic brain injury. Now, careful. The reality is that every one of us is going to fail at some of these at one point or another. But the key to diagnosing an intellectual disability is that you are dependable for someone to help you out on at least one of the 3 domains that I just mentioned. Now, some quick important facts about this disorder. 1% of the general population has intellectual disabilities, and males are more likely to be diagnosed than females. Now, the big question is, what is the cause of this disorder, right? The cause can vary. It can be genetic, in which case you might see typical facial features like in the case of Down syndrome, but it can also be acquired during the developmental period, whether because of meningitis, meaning infection of the thin outer coverings of the brain, or head trauma. It can also be acquired in the womb because of the mom's use of drugs or alcohol, or because of pregnancy complications prior to the delivery. Now let's talk about Squidward. You've noticed how Squidward appears gloomy all the time and seems to have low energy and tends to always kill the vibe at the Krusty Krab. Well, let's see if he has persistent depressive disorder. To meet the criteria, the person has to have depressive mood most of the day, almost every day, for at least 2 years. And you need to have at least 2 of the following symptoms over those 2 years. You ready? Number 1, has he had poor appetite or has he had overeating? Probably not over 2 years, right? Number 2, has he slept too much or too little? Number 3, has he had low energy? Yes, he's always got that face of,
I don't want to do anything except to watch Dr. Danny.
Number 4, does he have low self-esteem? I think only when Squilliam is around, but not constantly for over 2 years. 5, poor concentration or difficulty making decisions. I don't think so. Number 6, hopelessness. I don't think so. We might not have complete evidence to diagnose him with this disorder, but he does check off some of these symptoms. This is a psychological condition that usually starts in early adult life, and the earlier it starts, the higher the likelihood of drug use.
And what could be better than serving up smiles?
Being dead or anything else.
So SpongeBob, he's a happy dude. He's a happy sponge. He's got really nothing wrong with him in terms of mood. He just enjoys life, except when he has to drive. In this case, he's shown to have specific phobia when it comes close to passing a driver's exam, or any exam for that matter.
Is it hot in here, Mrs. Bob? Why is it so hot in here?
He has phobia to the extent that he starts sweating and gets overwhelmingly anxious, or he ends up with a full-blown panic attack and invariably crashes the car. Now watch, he completes criteria for specific phobia. Ready? Driving for his license exam almost always provokes immediate anxiety. And funny enough, He doesn't avoid the situation, but he does endure it with intense fear and anxiety. The fear is definitely out of proportion of the situation. I mean, his mind gets blocked and he forgets all the steps of how to drive, despite being in boating school for so many years. Now, does it last for more than 6 months? I don't know the timeline in Bikini Bottom, but the show started in 1999, so I think it's safe to assume that it's been going on for at least 6 months. Now, it also causes impairment because he can't be a regular sponge that drives himself. Instead, he has to ride his unicycle or walk everywhere. Now, let's finish talking about phobias real quick though before I give you another shocking condition SpongeBob meets criteria for. 75% of the people that have phobias fear more than one object or situation. People can sometimes go to extremes of avoiding the feared situation or object. For example, someone that fears snakes avoids seeing pictures of anything that even resembles the shape of a snake. Just imagine that. That would make living very difficult because there are many things that resemble the shape of a snake, even a shoelace. But even that would cause intense fear. Almost 10% of the population in the United States has phobias. The age group that is most impacted is 13 through 17 years old. And these kids get phobias to specific things, while adults for specific situations. Now, females are 2 times more likely to be affected than males. But blood-related phobias, can you take a guess who has them more? They're both about the same. Men and women have around the same prevalence of blood-related phobias. So now the big question, why do we get phobias? Well, we usually get them because of a traumatic event that happens either to us or that we see happen to someone else. Like for example, being attacked by a bear can develop a specific phobia to bears. Watching someone drown can cause you to have a specific phobia for swimming, even though you yourself didn't drown. But surprisingly, most people with phobias can't pinpoint exactly the traumatic event that occurred related to their phobias. Now question, do the phobias ever go away? Sometimes. Phobias are common in kids, and the course of the disease usually may wax and wane, and maybe even disappear in adulthood spontaneously. But if those same phobias persist into adulthood, they are unlikely to be cured in adulthood. I promised to tell you the shocking condition that SpongeBob has, so I'll give you a little sneak peek. He has a personality disorder that I'm going to reveal in the next video, so stay tuned.
So don't forget to subscribe and like.